Hey guys, it's Dr. Adam with A Sip of Aesthetics, and today we're going to be talking about fillers and some of the long-term effects, how long they last. We're going to talk about dissolving fillers because that's a topic that comes up. And we have Samira back with us.
I'm back.
It's great to have you back.
I hope you missed me as much as I
We
missed
did.
you.
We did. We had a great episode just a couple of weeks
Yeah,
ago. We've talked
we
about
did.
under eye fillers and under eye treatments. So make sure you check it out if you missed it. It was a great episode.
That was fun
It was.
and really informative.
Yeah. We had a
think so.
great, positive feedback on it.
Yeah.
So
Yeah.
make sure you check it out. But today we're talking about, something similar but a little bit different, fillers in general.
Yeah, I think right now we're seeing a lot of our patients come in and they're steering more towards a la naturelle.
Yes.
So, and that's my MO, so I'm loving this. But, I think that a lot of patients have a hard time understanding that, hey, the filler that you had done 3 or 4 years ago, it's still there.
Well, talk to us a little bit more about this because a lot of time, we see these fillers and they are, like approved for 1 year or approved for, 2 years. Most of them, are for 1 year. Does that mean that they're going to be fully gone in 1 year? Does it vary person to person? What does it mean?
I love actually explaining this to my patients because a lot of them get like super shocked about it. So I have always said, yeah, we say your filler lasts a year or what's on label is the last 2 years, but that's only because the FDA followed the patients in those clinical trials for a year or 2 years. It's gonna cost them a lot more money to follow people for 10 years. So I first bring that to their attention. So that's number one. Number two, sure, your filler is not gonna be at its peak result for the full 10 years, but unlike Botox where once your treatment, the 3 to 4 months is done, it reverts exactly back to baseline. That's not necessarily true with filler. There's always some remnants left behind. And I think that they have a hard time understanding because they're also staring at themselves in the mirror every day and they're not realizing what they looked like 5 years ago before those syringes of filler, right? So those two things for me is like how I explain it to them and then they're like, oh, okay, yeah, maybe you're right. Or the best thing is to show them the before photo. I'm like, remember her or remember him? And they're like, oh yeah, okay, that's what it was. So I think it's very important to educate your patients and that also goes into the informed consent that us as providers should be responsible for giving our patients because when they're coming in to see us for these major, it's your face, these major procedures, I think it's our duty to inform them that, hey, we're gonna be doing this and this is something that's gonna have a long-term effect. So I think that's the part that's been lacking in the last maybe 5-10 years when we were first starting with fillers. But again, that's just the natural way of things when more information is coming out.
Yeah. Well, and somebody might be listening to this and they might be thinking, that's not necessarily always a bad thing, which it's not necessarily always a bad thing.
No.
It's just more about being informed. And as you've mentioned, I think one of the funny things that happen is as we, somebody starts to do filler and then as we continue to age, we kind of forget how things looked before. And I think part of what happens is kind of as we age, we start to forget how we looked before too. And it's hard to really know exactly how you'd have looked without any fillers once you've had it done for a while. But it is something to consider as you're getting more and more treatments done.
Absolutely. And now I think like I'm just being more mindful in the types of fillers that I'm also choosing for certain patients. So I'm sure you saw that big, I think it was like a crazy social media, like everyone was talking about that MRI study that was done on that 20-something-year-old girl where she didn't have fillers done for 6 years, I believe. And she had, don't quote me, but maybe like 12 syringes of filler over that 6-year period. But her MRI was showing 6 years later that not only is the filler there, but 2 times more of the volume in water because of some fillers drawing in more water than other fillers. So I'm trying to be more cognizant in the type of fillers that I'm choosing in certain areas of the face, because I think that's what's contributing to the filler face that people are starting to hate now and want to go towards natural.
Yeah. Well, and again, I think fillers still play a big role, and there are a lot of things that we can do with
Absolutely.
fillers that we can do with other things, but I think it's important for the provider to be aware, so that they can kind of manage all that stuff as we're doing
Exactly.
the treatment. What are some of the factors that you think play a role, and how long the filler would last? I mean, you already mentioned the type of the filler
Oh yeah,
that's
the
being
type
used.
of the filler, I think the plane that in which it's injected in, and I think lifestyle. So people who are working out constantly, this goes true with Botox, I think they metabolize through these products a lot faster. I think people who smoke cigarettes mainly, I think they increase the metabolism of these products. And I also think that it has to do with just that individual's metabolism overall. Is that
Yeah,
correct?
I,
That's what I
I, I
was told.
100% would agree. I mean, I think there's definitely it's gonna vary from person to person,
Hmm.
and lifestyle factors, but probably even genetic factors. And I mean, we see that just in real life too, where sometimes we'll do, you do filler on the patient, they come in, 2 years later and it still looks great, versus somebody else might come in like
Yeah.
9 months and you're like, you don't see it
What
as much. It's
happened?
mostly
Yeah.
gone. So if somebody actually does, for whatever reason, want to dissolve, because I know we mentioned we're going to talk a little bit about filler
Yeah.
dissolving, so maybe we can talk a little bit about that. When do we dissolve fillers, and what's kind of the process like?
So I think it's really sad that in our industry, dissolving has not been a very, how do I say, like we haven't really been properly trained, and there's no real protocol about how to dissolve and what the necessary steps are for dissolving until more recently, which blows my mind, because
Yeah.
this is kind of like that enzyme that we use to dissolve the filler. It's an antidote to potentially save a very harmful complication that can occur, a vascular occlusion. So I've it's mind blowing that people are so inexperienced with hyaluronidase, or Hylenex is what we call it. So again, guys, do your research, go to a provider who is knowledgeable and comfortable with using the enzyme. And Hylenex can be a little uncomfortable for the patient. I'm gonna be honest. I say it's very spicy, but I think in a time where it's absolutely necessary, whether it's an emergency situation, or I like to sometimes use fillers when we kind of got to start over. Some patients have that fish lip migration of filler that I want to bring back their natural structure back into their lips. So I will go ahead and dissolve that. Or um, maybe an outlook or outcome that they don't really like after it's been sitting, and they have a new outlook on how they want to look. So that, again, going towards more natural. So I'll go ahead and dissolve those patients. I'll dissolve the patients kind of like what we talked about in our last meet, for under eye filler that just was done improperly, or it's causing pooling of the lymphatic fluids in the under eyes. And then sometimes, there are some more fillers that are more cohesive and they kind of lump together. So sometimes I'll just put like a little bit to kind of soften that up for the patient if that ever happens. But I'm not seeing that too frequently anymore, like nodules or anything. But I would say the two main ones, or my biggest one, is lip filler migration and just overall migration and under eye filler that's kind of gone bad.
Yeah. Yeah, and just kind of to reinforce what you just said, I mean, there's really kind of two main reasons we would do, dissolving. One of them is if there is a potential complication, and as you've mentioned, that's why it's important to go to a place where they're
Mm-hmm.
knowledgeable, or where they have had the training, they are equipped to use something like that. Because first of all, just kind of talking about here, when somebody comes in, we're going to do our best to limit the chances of anything kind of bad happening.
Right.
But you can never make it zero. But you want to be, you go into
Exactly.
a place where if something bad happens, they have that
They're
ability.
equipped.
Exactly.
And they know what to do.
Exactly. And unfortunately, as you mentioned, not every place is like that. I mean, now I've done it. I've went because I do training sometimes for other places. I went to a place to do training, and they didn't have that product,
That's
and that was
insane.
crazy. You don't even. What if something wrong happens? Like you don't even have the product to inject,
That's
and,
insane to
and
me.
solve the problem. Because a lot of times with these complications, you want to get to them as soon as possible. And if you can treat it right away, you can sometimes not have any long-term
Time
effects.
is of the essence with
Exactly.
that stuff.
So you do want to go to a place where they have that. Now, luckily, most often we're not dissolving for this reason because there's a complication.
Yeah.
Most of the time, we're dissolving is more for aesthetics reasons. As you
Right.
mentioned, somebody had some migration, or we wanted to kind of start over in a certain area. We do see sometimes people will come in and they've had their injection done, in the wrong plane or something, and they just want to kind of start over or dissolve some of that filler and kind of do something else. So that would be the other reason, as you've mentioned,
Yeah.
to dissolve.
I think it's so important that our patients are also aware that I think it's aesthetics in general, especially filler injections, has been just such a it's such a normal thing, especially here in LA, that I don't think patients realize just how things could go wrong when it comes to filler. If you're going to someone's backyard and getting it injected, or remember that fad, there was like this hyaluron pen that people would purchase on Amazon and they're self-injecting their lips. But what patients don't understand is this stuff's dangerous if it's in the wrong hands. You can easily inject a filler, and this is with any filler anywhere of the face, body. Anytime you're undergoing that procedure, you're at risk for vascular occlusion, and this is one of the most emergent types of outcomes, of which requires you to be very knowledgeable about what to look for so that you can contact us so that we can reverse it. But you guys need to know the risks that you're taking when you're sitting down in a chair and going for filler. So, and I always like to tell my patients, you can go to the best injector in the world, and it's not about if it's gonna ever happen to them, because if you're seeing so many patients in your career, it's bound to happen at least once or twice, even if you are the best injector ever, because anatomy is not textbook. Not everyone, like, my artery is not going to sit in the same place that the textbook tells me. There's anomalies. People are different. There's different bone structures. Ethnic groups have different. Everything is so different for everyone. So it's not about if it happens. It's about when it happens, that you're in the right hands and that we can reverse it for you and make sure that you're safe. I think that's the number one thing that patients don't realize and they should do research on when it comes to filler injections, especially.
I agree. I mean, it's there's definitely like on one hand, there's definitely a lot of things that you can do to minimize the risk. Because I've also seen people who, as you've mentioned, like with the hyaluron pen and things where people are injected blindly, and you're like, "What are you doing?"
Wow.
Like you're like you can see something going wrong
Yeah.
because you're doing it wrong. I mean, sometimes they get lucky and nothing happens. So you can definitely like decrease that chance from like, whatever 20-30% to like, 1%, or less than 1%, 0.5, but it's never going to be 0 0. And if you're seeing thousands of patients over your, lifetime, then, something is bound to happen. But as long as you're ready and, you're equipped and you do your best, that's all you can do really.
Absolutely. I just think patient education, number one, and just us as providers staying on top of the latest techniques and all. It's so important. It's so important.
Well, and that's why it's also so important to, as you mentioned, stay on top of the technique. So kind of continuing with keeping up with the industry, because with this industry, I've seen people where they kind of like, learn, a couple things, and then they kind of just sit in their own corner and they
Stick to it.
exactly.
Yeah.
But you always want to keep up to date. There's a lot of great conferences that are always going on and stuff, but you have to actually make the choice that I'm gonna go to it, that I'm gonna be, reading about what's new. I'm gonna keep educating myself. There's a choice that you have to make as an injector, and you
Absolutely.
kind of owe it to your patients to do that.
Absolutely. Cadaver courses.
Yeah.
I think every injector should have done at least one cadaver course. Like, it's so important.
Yeah.
It's so important.
No, you have to know your anatomy.
Anatomy. And I still, like, some providers don't like aspirate in certain areas that are a little bit more prone to dangers. I'm an aspirator, and I'm
Yeah.
sure you are too, because we just want patients to be safe.
So if you're somebody who's listening to this podcast and you wanted to get some of these injections, as we mentioned, it's really important to go to a place where they know what they're doing. So for somebody who's listening who lives not here, if you're here, just come to us.
If you're in Zimbabwe,
But
like all the way across the continents.
if you are somewhere else, what are maybe like some things that they should look for, or that they can ask their injector just to kind of get a feel? Like you kind of mentioned one that's important, if they are taking courses like a cadaver course or things like that.
Totally.
Are there other like tips that you would say, or you would give some?
I would definitely want to know if someone's board certified,
Mm-hmm.
because apparently there's some people that are, they are healthcare professionals, but maybe in a different country or whatever it is, or haven't been practicing in a long time, so they're not board certified, up to date with their board certification. I want to ask my provider, have you had any vascular occlusions or complications? If so, how many? And number 3, I would say, in case that happens, I know it might not, but in case it happens, are you equipped to be able to save my face?
Yeah.
I think those are very
Important.
Those are important questions, and I think it's fair to ask as a patient
sure.
to your provider. I'm ready to answer those questions for my patients. So.
And I think honestly, another one is just trust your instincts. Like it's so fun. I don't want to say so funny, but like sometimes we see people who come in and they're coming in to fix a complication that has happened somewhere else, and they're like, one of the first things that they say, not always, but sometimes, like, I know I shouldn't have done this because like we went in there and it was like the place looked like all messed up. There wasn't anybody. We didn't sign any consents. No one even asked for like to check our
phones.
They're not checking our ID. They're not checking who we are. You just walk in and then you just walk in there and there's like a bunch of people and or it was like somewhere like in the backyard somewhere, somebody's house and things like that. And I didn't feel good, but my friend was doing it, so I was doing it.
Yeah, exactly.
And we get that a lot of times, like and if you're really not feeling good, maybe you shouldn't go on with the treatment. If you really have a bad feeling. Now, we get people who are nervous all the time when they're starting a new treatment. Like it's very normal to be a little nervous if it's your first time getting Botox, first time getting filler, first time getting a laser. But that's different than, just not being comfortable with the person in front of you who's doing your treatment, not being comfortable with the setting, but just kind of feel pressured to do it because, somebody else is doing it. Just kind of trust your instincts in this case.
Always go with your intuition. Always go with your intuition because your intuition is right. And I think when it comes to patients being more nervous or scared about a treatment, totally normal, but that's where we come in.
Exactly.
It's our job to make them feel comfortable.
Yeah.
I don't want to do anything on my patient if I don't feel like they're 100% comfortable. Yeah. Sometimes I tell them, you know what? Here's a brochure on what I'm recommending. I want you to do your research. And then if you have any questions, call me. Yeah. I want to build that trust with them so that they're comfortable on my chair. Yeah.
And a lot of times too, we can start slow and then kind of build from there. But when somebody comes in, they're not really nervous about that treatment because we've had fillers, they've had fillers 10 times before, but just that one time with that specific provider, they were very uncomfortable. Then this is different than just being a little anxious or something about in your treatment that you're getting, because that can also be like anxiety but also excitement because you're gonna start in this treatment, which is a good feeling.
Glow up.
Well, thank you guys for joining us. thank you, Samira, for being
Thank
back
you
with
for
us. It's
having
always
me.
great having you.
I had so much fun.
Thank you. Well, leave a comment, subscribe, like, and join us next week for the next episode.